Now, TB patients in Ghana risk dying or having multi-drug resistant TB due to an imminent shortage of essential TB drugs at health facilities across the country. Now, 54-year-old Jojo, who's been on the medication for the past 6 months, was given 3 weeks supply of his medicines instead of the usual 1 month supply. My colleague Sarah Apenkra reports that drugs are currently being circulated among the health facilities to meet patients' needs.
Our checks at one of the major referral hospitals in the country revealed a complete stockout of the following essential drugs: isoniazid 300 mg, ethambutol 400 mg, clofazimine 100 mg, pyridoxine 100 mg. There was very little stock left of the rest of the drugs, which can barely last the facility for a week. 54-year-old Jojo, who has been on the medications for the past 6 months, has drugs that can last him for only 3 days before his next visit for more medication, and he's already worried.
Sometimes me call mommy for 3 weeks. I don't know, say now a short and
I don't know if it's because of the drug shortage. I was given only 3 weeks supply, and what I have will finish in 3 days.
Yeah, come 3 times I mefa.
Jojo is just one of over 76,000 Ghanaians suffering from TB and requiring medication for survival.
Said yeah, na me hunam me na de no. Say me who said me okay.
We have been told not to break in taking the drugs, so I don't know what I will do if I go and I don't get any more.
Mr. say omobama yedro no more. Said ya be ya nipa bebre na omonya saa yare we no omobenya akomidi afa ho.
What is more alarming is that statistics from the Ghana Health Service indicate that more than 30 lives are lost to tuberculosis in Ghana each day, while more than 120 people get infected by the TB bacteria daily. This imminent shortage of drugs in the country is due to the fact that Global Fund commodities for HIV and AIDS, TB and malaria remain locked up at the ports despite assurances by the government of their clearance.
For now, where there is a facility with some stock and new cases come into onto treatment, you have to find a way to pick the medication from some facilities, maybe from one region to the other. The only thing the program can do is to manage what is left.
Out of the 185 remaining containers that have been at the port for over a year, only one contains the TB medications, which the government is finding difficult to release, though it is aware of the imminent dangers. The Executive Secretary of the Stop TB Partnership Ghana, David Kwesi Afre, says all efforts to make the government understand the gravity of the situation have proven futile.
About $86,000 or so, and that was paid. Now it's left with whatever process they have to do quickly. The update I had as at last Friday was that the payment was done, but the clearance isn't done yet. And so for the past 1 month, we, the TB community, have been interested in pushing for clearance of that one container that contains TB medication. And it is still not cleared.
The experts have warned that the repercussions of the situation will not only end with the TB patient, but many more people risk being infected. These drugs need to be cleared as a matter of urgency. Sarah Apenkra, TV3 News, Accra.